the social significance of sport, physical culture, and recreation in carceral settings. And he is interested in questions of social control, agency, and resistance in and through physical activity. He is the PI on the principal investigator, on a SSHRC-funded study on sport and recreation in youth custody facilities. And in 2019, Mark was invited by the United Nations Office on Drugs and Crime to participate in a global experts meeting on sport and youth crime prevention. Today, Mark is going to talk about the complex relationship between sport and physical activity on one hand and health on the other hand in prison settings. I didn't know that, but it appears that globally, more than 10 million people are incarcerated and live, so to speak, in institutions that often are unhealthy spaces characterized by threats of physical violence, the risk of communicable disease, as we know now with COVID-19, and poor diet and nutrition and monotonous routines. Interestingly, these unhealthy spaces of confinement are also home to vibrant physical cultures through which prisoners produce myriad social meanings. While sport and physical activity can provide important physical and mental health benefits to some prisoners, they can also contribute to unhealthy outcomes like physical violence and social exclusion. The paper that Mark is going to present considers these complex meanings and relationships, and he proposes as well several ways in which sport and physical activity might play a role in improving prisoners' health. So that's a fascinating topic, and without further ado, I pass it over to you, Mark. Thank you very much.
All right, thank you so much, Michel, and thanks to the organizers for inviting me, and to all of you who are joining us today virtually. I've not done a Zoom presentation like this before, so it's both exciting and a little daunting, but hopefully it will go all right. So Michel gave you, I think, the background that you need about me and what I want to be talking about, and ultimately today what I'm attempting to accomplish is to link the research that I've done as well as the wider literature on the social significance of physical activity and sport in prisons to what we know about prisons and health, and to, I think, ultimately probably raise more questions than I answer, but I hope in so doing to kind of more directly connect those areas and open up some lines of discussion to think more deeply about those. Briefly, what I'll be covering today, I'll give a brief introduction and context around, mostly around incarceration and incarceration in Canada, for those of you who are not familiar with that topic. I'll talk broadly about some of the issues. Michel mentioned them from my abstract around prisons and health before talking about sport and physical activity in prisons. And then kind of the crux of what I want to talk about are kind of questioning the extent to which prison sport or prison physical activity is a healthy undertaking for prisoners, and suggesting some alternative approaches to thinking about prison physical activity and health before concluding. So I'll begin with a little bit of context. So worldwide, there are roughly close to 11 million people in prisons or detention globally. It's very hard to get precise figures for various reasons. In Canada, on a given day, there are roughly 41,000 people in prisons, of whom about 14,000 are in federally run institutions. Bear in mind that these totals represent sort of a single typical day. And in fact, in Canada alone, well, more than 41,000 people will be in prisons on a given day. In fact, approximately 250,000 adults and 14,000 youths will be incarcerated in a given year. And those statistics are from the early 2010s. So the actual number of people who are incarcerated in a given year is much higher than the rates that are shown there. And you can see on the right where this places Canada in relation to some other nations in the world. While we're not the United States, Canada still has quite a high rate of incarceration. Canada's correctional systems are, it's quite a complex network of 14 interconnected but separate systems, one operating at the federal level and one in each province and territory. And as a general rule, there are exceptions. Federal correctional institutions are where people whose sentences are 2 years or more are sent, and provincial and territorial institutions are where people whose sentences are less than 2 years or who are awaiting trial or remanded to prison. So federal institutions will have people there for longer periods of time, whereas provincial and territorial have a lot more movement in and out due to the short length of sentences. Given these differences just in Canada, let alone globally, it can be challenging and in fact even problematic to make too many generalizations about the experiences of incarceration. There can be significant differences between different correctional institutions or prisons based around a number of features, including the correctional system that they're operated by and the policies of that system, the security levels of the prison, for example, the experience of someone held in a minimum security versus a maximum security prison will be very different, as well as the gender of prisoners held in the institution. The experience of men and women can be quite different while incarcerated. And as well as the experience of people who identify neither as male or female yet are held in an institution assigned to a particular gender. And these differences affect all kinds of aspects of life in prison and the lived experiences of prisoners, including the types of risks that they experience and have to navigate, the kind of subcultures and subcultural values that are developed amongst prisoners, and the way in which prison spaces or programs are organized and structured and the degree to which they're accessible. So despite these differences, there are broad theoretical patterns and common lived experiences for incarcerated people. And I will be drawing on much of that theoretical literature in this talk, but I do want to just bear in mind that there will be nuances and particularities between different institutions, different correctional systems, etc. I also want to briefly mention, I'm talking today about sport and physical activity. In the sociology of sport literature, there's considerable debate about how these terms should be defined, and I certainly don't want to drill into the particulars of that. What I will say is that while there's no universal definition, I take quite a broad view of these terms, that it can encompass a wide diversity of forms of human movement that carry various individual and collective meanings for their participants. And I'll be talking about quite a broad range of activities in my talk today. My research in this area has involved several different studies around sport and physical activity in different correctional contexts. Much of my work has focused on the federal prison system through interviews with former prisoners and archival research. And today I'm going to largely focus on the federal system in this talk. It's just kind of too much to cover all the ground, but I've also, I'm currently doing a study on the Ontario youth justice system with a particular focus on secure custody facilities. And that's involving surveys and interviews with staff working with justice-involved youth. And I've also done research on yoga programming in prisoners, largely through interviews with yoga teachers who have volunteered their time to teach yoga in prisons. Michelle talked about from my biography some of my overarching theoretical interests, and these are, as you'll see, theoretical inspirations and foundations that are weaved throughout my work. And I will, as you'll see, interlace some quotations from participants in my research throughout this talk to try to lend some richness and depth to the broader theoretical questions that I'm talking about. Next, I want to just briefly talk about some of the issues around prisons and health. And I want to start by noting that prisoners, broadly speaking, globally and both within Canada, are disproportionately drawn from marginalized social groups. There's an overrepresentation in many prison systems, including Canada's, of racialized groups, people from poor or low income backgrounds. And as I'll talk about a little bit later, prisoners have much higher rates of mental illness and histories of victimization, including and exposure to childhood trauma and abuse than the general population. Sociologist Loïc Wacant, commenting on this phenomenon, notes that prisoners are a population thrice stigmatized. They are lawbreakers who are overwhelmingly poor and darker skinned. And although Wacant was talking about the American context, his statement holds true in Canada. Just to give a couple of statistics around this in Canada, looking at the federal system, just around 25% of federal prisoners are Indigenous, despite the fact that Indigenous people are just 4.7% of the Canadian population, and around 7% of federal prisoners are Black, despite the fact that Black Canadians are roughly 3.4% of the total population. So just among those two racialized groups, you can see the severe overrepresentation in the federal prison system. The number of women prisoners is around 6%, although that number has been growing, and a shocking 42% of women who are incarcerated at the federal level are Indigenous. Layered on top of the fact that prisoners are drawn from these marginalized social groups is the fact, as Wacant points out, that the stigma of being a criminal drastically affects prisoners and former prisoners in a variety of ways, including many that directly relate to their health. And given what we know about the social determinants of health, these points that I've mentioned on this slide are important factors to bear in mind when talking about prison health. I also want to introduce a concept known as the pains of imprisonment. This was developed by criminologist Gresham Sykes in the 1950s out of an ethnographic study in a men's prison in the United States. And he coined the term to describe what he called the deprivations or frustrations of prison life. And as you see on the right, Syke identified 5 deprivations of imprisonment. Loss of liberty, being deprived of goods and services that you might have accessible in the community. Sykes identified heterosexual relationships, but as scholars have pointed out, that might be better identified as involuntary celibacy, that prisoners are restricted in their ability to pursue or engage in sexual relationships. And then deprivations of autonomy and security, the fact that prisoners lack freedom over their daily lives and that they live in conditions in which their security is often at risk. This concept of pains of imprisonment has been extremely influential to the point that some scholars have argued it's overused and a little bit ambiguous in its meaning. And it's been, as a result, significantly critiqued and refined and expanded since its introduction over 60 years ago. Among these critiques include recognition that specific populations will experience unique pains of imprisonment. For example, research on women's incarceration shows a variety of pains not experienced by male prisoners. Youth will experience different pains than adult prisoners, and people committed for or incarcerated for specific offenses, for example, sex offenses, will face very different challenges and pains of imprisonment than people convicted of other offenses. There are, not surprisingly, since the late 50s, some new pains that have been identified that were not identified by Sykes. In that time, there's been significant changes to the kind of philosophy of prisons and the ideology of punishment. Rates of incarceration have grown significantly in most countries. And of course, new technologies have changed the experience of life in prison and the extent to which prisoners, for example, are surveyed or monitored. And lastly, a really important critique to bear in mind is that some pains are more detrimental than others, and it's important not to assume that any inconvenience or discomfort or distress a prisoner might experience is equivalent to others that may be more severe. So given these critiques, this concept remains influential, and I think remains very helpful. As you'll see, I kind of lean on it quite a bit to think about prisoner health. And despite the critiques, there's a general widespread recognition in the literature that incarceration does entail various pains that are unique to the experience of incarceration, and that these pains create suffering amongst prisoner populations. In Canada, prisoners, very interestingly and problematically, are actually not provided the same, are not covered under the same healthcare legislation as non-prisoner Canadians. Federal prisoners are excluded from the Canada Health Act, and their healthcare is covered under the Corrections and Conditional Release Act. The Corrections and Conditional Release Act, which I've quoted on the right, explains that the Correctional Service of Canada shall provide every prisoner with A, essential healthcare, and B, reasonable access to non-essential mental health care, if it will contribute to the inmate's rehabilitation and successful reintegration. And as scholars have pointed out, this is somewhat of a problematic definition. What is deemed essential is actually defined differently by the Correctional Service of Canada for prisoners than it is for those seeking healthcare in the general public. The concept of reasonable access to mental health care is ambiguous and leaves a lot of room for interpretation. And ultimately, scholars have critiqued the policy for creating a reactive rather than a proactive provision of healthcare to prisoners, reacting to health problems that come up rather than taking a proactive approach of trying to create healthier living environments and intervening to try to improve prisoner health. Given these critiques, it might not be a surprise that amongst formal complaints filed by federal prisoners, healthcare is the biggest for the year 2019, for which there are most recent statistics. So prisoners who file formal complaints identify healthcare as the most significant issue, and many of the other complaints that show up are related to other dimensions of health, such as conditions of confinement, the living conditions that they experience, or issues around visits from family and friends, which obviously could have very important implications for social and mental health. I'm focusing largely on the federal system, so I'm just going to quickly note that at the provincial and territorial level, healthcare for prisoners is organized differently, and there is variable quality experienced at those levels. Prisoners, as I alluded to earlier, not only are drawn from marginalized groups overwhelmingly, they also experience significantly higher rates of serious health issues compared to the general population, including rates of infectious disease, chronic health conditions, mental disorders, and experiences of childhood trauma and physical or sexual abuse. Furthermore, the deprivation experienced in incarceration can create new forms of psychological and physical distress or exacerbate existing ones. As Kyumjin and colleagues note, the broad characteristics of incarcerated Canadians' health shows poor health across a range of health status indicators, and that this finding is consistent with the international data on those who experience imprisonment. I also want to note, and this ties in with my theoretical interest in carceral space, that the way in which the space of prisons is produced. That is the way in which it's given meaning and experienced through its design, through social interaction in those spaces, and the confluence of those factors creates a variety of ways in which prison space has negative impacts on prisoner health. These include, at the best of times, crowding. Most prisons are crowded spaces with lots of people living and working in confined spaces, and often overcrowding. This became a particular issue in Canada in the mid-2010s as a result of policy changes at the federal level that resulted in longer sentences and more sentences at the federal level for certain crimes, and forced some prisons into, for example, double bunking, which means putting 2 people in one cell, and prisons became increasingly overcrowded. There's a high movement of people in and out, not only prisoners who, as I mentioned earlier, come and go out of prisons on a regular basis when sentences end or start, but also staff as well as volunteers. And as with all of these points, COVID-19 has thrown into sharp relief many of the problems of prison spaces. And these also include oftentimes a lack of fresh air or poor cleanliness and sanitation, as well as the use and in some cases abuse of solitary confinement or segregation. That is placing a prisoner in a cell where they're locked for 23 or 23 and a half hours per day and only permitted outside for a short time to walk outside or take a shower, make a phone call. And notably, the fundamental fact that prisons are spaces designed and built to involuntarily confine and isolate residents, which is the fundamental and foundational fact underlying the existence of prisoners, which obviously has significant implications for their health, as I've discussed. Moving on, I want to now talk a little bit more about sport and physical activities in prisons, drawing both from my research as well as the broader literature in the area. And I want to begin by discussing an extreme example of a prison sport activity, and one that's widely known and quite prominent in the popular imagination. And I picked this example because I think it throws into relief through its extremity many of the tensions that underlie the social meanings of sport participation in a prison context. So this picture and this poster that you see on the slide are from an event called the Angola Prison Rodeo, which takes place twice a year at the Angola Maximum Security Prison in Louisiana. This is a prison built on the grounds of a former slave plantation, where among the over 6,000 prisoners who reside there, approximately 75% are Black. And it's a prison that hosts twice a year a public spectacle consisting of several rodeo events that prisoners participate in for members of the paying members of the public, sorry. And this event has a really significant tension between exploitation of prisoners and providing them with an opportunity for the expression of agency. The event can absolutely and should absolutely be read as exploitative in various ways. Firstly, and significant for physical health, prisoners are exposed to extremely high risks of spectacular and very damaging health, violence with important health consequences. This is most prominent in the 2 most popular events in the rodeo. The first, which you see a picture of here, is called Convict Poker. 4 or 5 prisoners sit around a table as though they were playing cards, while a wild bull is released into the ring and runs loose. The last man sitting is the one who wins. And as you see in the picture, oftentimes that involves prisoners being physically removed from the table by the bull. And the second is called Guts and Glory. This is the showcase event that is most popular with audiences and most prestigious to compete in amongst prisoners. In this event, a poker chip is tied to the horn of a bull, and several prisoners compete to be the first one to untie it and acquire the poker chip. Clearly, these are events that put prisoners at very high risks of serious injury, and indeed there are often very serious injuries arising from it. Prisoners, who again are largely racialized, also perform for the public exaggerated convict or prisoner roles through the way in which the event is presented, including through wearing outfits, striped black and white shirts that align with popular representations of prisoner attire and presentation. And through their participation, prisoners contribute to a symbolic display that in the, through its representation presents particular meanings about prisoners as others, as sort of almost dehumanized non-members of the public, and also legitimizes the prison regime and the broader system of punishment that confines them in Angola prison. And the event is widely promoted and celebrated by the prison administration for the public relations opportunities it presents. At the same time, despite being exploitative, despite putting them at high risk for physical injury, prisoners highly value participating in this rodeo. It's seen as extremely prestigious. It's a chance for prisoners to demonstrate qualities that are prized within the prisoner subculture, largely relating to hegemonic ideals of masculinity, such as toughness, such as bravery. And it's a chance through participating in front of a crowd, through being able to spend time outdoors and preparing in the build up to the event, to experience a degree of quote unquote freedom from the daily monotony of life in Angola prison. So prisoners are, in that sense, willing participants in the event and seek and acquire benefits and gains from their participation, despite it being done in a coercive environment. So I wanted to talk about that. It's an extreme event. It's certainly not typical of prison sport or physical activity, but it's one that I think helps illustrate some of the tensions that play out maybe in more subtle ways through other forms of physical activity in sport. And I'll return to many of the theoretical themes I've just brought up as this talk progresses. This is not an exhaustive typology of the types of prison physical activity, but I did just want to briefly mention, sort of broadly speaking, some of the types of activity that occur in prisons. And this is how I've loosely and broadly categorized prison physical activities based on the literature and my own research. So again, this will depend on the prison and all the specifics of that institution and the correctional system it's in, but generally speaking, in prisons, we find traditional competitive sports, so sports like basketball or softball, floor hockey, etc. Fitness and bodybuilding activities such as weightlifting, body weight exercises, and regimens that involve push-ups and chin-ups, etc. More low-key recreational physical activities, walking or jogging, playing physical games such as horseshoes. Exceptional or one-off events like the Angola Rodeo I just discussed. In some cases, there are charity events organized involving physical activity where prisoners either inside or outside the institution will do a charity walk and raise money to donate to charity. And so these kind of more atypical occasional events. And lastly, what I call alternative activities, and I'm going to talk more about these in a few moments. that are structured and have quite different characteristics than the other activities, often with a focus on therapy or rehabilitation. And the provision of sport and physical activity for prisoners is enshrined in the United Nations Mandela Rules, also known as the standard minimum rules for the treatment of prisoners, which has a short section on sport and exercise, which states that prisoners must be given at least an hour outdoors each day, and that particularly for youth and some other prisoners, physical training or physical education and recreation spaces should be provided. In Canada, at the federal level, physical activity falls under the banner of leisure activities, and these are defined as structured and unstructured activities that encourage inmates to develop and maintain a healthy pro-social lifestyle and to use their time constructively. This policy or commissioner's directive, as you'll see, is very vague about how physical activities should be healthy, or how while they're clearly linked with health, it's not clear how health is understood in this context. And further, physical activity is placed in service of achieving instrumental goals of the correctional system, making prisoners quote unquote pro-social or quote unquote constructive. In other words, physical activity should play a role in inducing behavioral change in prisoners in ways that align with dominant understandings of rehabilitation. And I can't get into it deeply here, but rehabilitation is a concept in corrections that has been critiqued by scholars on several grounds for being problematic in the way it's in the way it's represented and enacted. And I just also like to point out that there's no mention in the policy about how physical activity should or should not be constructed to be healthy, and other possible outcomes from physical activity that might benefit prisoners, including possibly their health. And I will talk about some of those in a moment. So given that context, I asked the question, are prison sports and physical activity healthy? And to delve into that question, I want to begin not focusing on prisons, but just talking more broadly about and problematizing a commonly held view that sport or physical activity participation is an inherently healthy undertaking. As the poster on the slide shows, there's even a movement to label exercise as medicine. That's gaining global traction. And indeed, research demonstrates that exercise can have numerous health benefits, physical, mental, and social, for participants. So there's no question that physical activity can be healthy, but is it inherently healthy? In reality, physical activity participation carries numerous and in many cases quite severe risks to health. Some of these are inherent. If you go downhill skiing, there's a reasonable chance you might crash and break a bone or get a concussion or worse. If you're a cyclist like I am, biking in Hamilton, there's a not unreasonable chance you might have a crash or be hit by an automobile. You might go for a hike and sprain your ankle or fall and injure yourself. There are inherent risks to different activities. Obviously, the degree of risk will depend on the activity itself and the way in which the participant performs it. But there are also subcultural factors that can make sport and physical activity unhealthy. For example, athletes who take performance-enhancing drugs to be able to run faster or lift more weight. Hockey players who engage in fist fighting as part of a masculine code of honor within the sport. And there are countless other examples depending on the subculture around particular sports. But health risks are not limited to elite or professional sports. Indeed, data on serious injuries amongst Canadians shows that injuries related to physical activity were the majority of serious injuries for those aged 12 to 19 and aged 20 to 64 in Canada, according to recent statistics. ahead of injuries arising from transportation, house-related injuries, or work-related injuries. And amongst the age group 65 plus, sports and physical activity-related injuries were the second leading cause of severe injury. So it's problematic to simply say that participating in physical activity is a healthy undertaking. And we need to keep that critique in mind. Given that, when we look at sport and physical activity in prisons and its link to health, research, including mine, has identified several ways that prison physical activity can contribute to unhealthy outcomes for some prisoners. And this is far from an exhaustive list, but sport and physical activity may create opportunities for or exacerbate physical violence. It can be a site for violence that causes serious harm, even death in some cases. Sport can be a means to create or solidify social hierarchies within the prison that marginalize certain prisoners and socially exclude them from participation in sport and physical activity. It can make certain spaces feel unsafe or unpleasant. The prison yard and the weight room were particularly identified by former prisoners I spoke to, male prisoners particularly, as potentially unsafe or risky spaces. And it can encourage other quote unquote deviant behavior, such as taking steroids in an attempt to increase muscle size and strength related to weight training or fitness training. Sam, a former prisoner I spoke with, talked about floor hockey matches while he was incarcerated. And he said they called it war hockey rather than floor hockey. It was pretty violent. They knew someone was going to get hurt. So that's why we called it war hockey, because guys were getting stitches and all that. I didn't want to play war hockey because they fight and I wasn't into the fighting routine. So you can see here how participating in this prominent form of physical activity or sport for prisoners carried with it a risk of physical violence and negative health outcomes. On the flip side, research also shows many ways that physical activity can provide prisoners with positive health experiences, including the physical health benefits that can arise from safe and pleasurable physical activity participation. Many prisoners identify sports as a way to mentally escape from the daily experience and the pains of imprisonment, to kind of take their mind off it, to kind of forget where they are for a short period of time. Sports can be an opportunity for some prisoners to imagine and even develop a sense of identity that's separate from that of being an offender or a prisoner. And this can be important for prisoners once they're released to be able to have a sense of themselves and an identity that's separate from their incarcerated past. Sport can produce meaningful social interactions, either between prisoners or with volunteers who come in to assist with sport programming, or even with staff in some cases. Or it can be, and I think this is an understudied but important point, simply a way to experience pleasure in an environment where there are limited opportunities to do so. I don't think there's anything wrong or problematic with physical activity being done for its own sake, for the pleasure that it creates, without having any necessarily any instrumental goals attached to that. James, a former prisoner who I interviewed, spoke about some of the benefits he received from physical activity and his views on it. He said, there's the physical aspect, and then there's the psychological aspect, because it's all part of a healing process. All of a sudden something clicks in. That might be the first start of rehabilitation process, that psychological aspect. All those men that are inside, they were little boys once. They might trigger something that might benefit them and be part of the rehabilitation. So you can see here for James, physical activity was an important part of his, not just physical health, but his mental health as well. And his experience of identity while incarcerated. In order to understand if and how prison sport and physical activity might be healthy, we need to recognize and seek to understand how these activities are situated within the broader structures within and outside prison and the various facets of prison life. And these include correctional policies, experiences of and navigation of risks amongst incarcerated people, subcultural values, talked about spatial production, and the healthy and unhealthy aspects of the prison that I've discussed. And this quotation from Dave, a former prisoner, I think touches on how we need to understand physical activity within or situated within these other issues. So Dave writes, Dave stated, "I got the nerve to go to the yard because, the yard seemed kind of scary to walk in. To get down to the gym just to try to get my body back together again. Because talk about unhealthy weight loss, starvation diet. It was all white bread, watery soup. It's Auschwitz soup. That horrible weight loss, and it's incredibly unhealthy." So Dave here identifies physical activity as a vehicle through which he can reclaim his health that has been damaged through unhealthy aspects of incarceration. Yet to do so, he has to navigate spaces that carry risk of physical harm. In order to access the equipment he needs to access to go through that process. So it touches on several of these broader aspects. And there are implications for prisoner health beyond the prison when it relates to sport and physical activity. And I think it's important to keep these in mind, because most incarcerated people will return to the community, often within a relatively short period of time. And if some prisoners find positive health experiences from participating in physical activity while incarcerated, it's crucial that we seek to understand whether and how these experiences can continue beyond the prison walls. And indeed, in my research, I've found several significant barriers for such continued participation. These include social stigma and what scholars call the carceral habitus, that is the sort of embodied experiences of incarceration, the way people look and act and carry themselves as a result of being incarcerated, that often place them at odds with the way that people present themselves in the community. And these can extend the pains of imprisonment beyond the period of incarceration, and indeed limit opportunities to participate in meaningful physical activity or sport in the community. Susan, a woman who volunteered to teach yoga in prisons, contrasted her experience teaching in prisons and the prisoners she worked with the clientele she taught in the community, a clientele that another yoga teacher I spoke with identified as, quote, middle-class white women in Lululemon. And Susan wrote, where the yoga studio was geographically located, it would not draw upon the community that live in the north end of the city, who are generally the folks who are more economically marginalized, more racially diverse, and where people recently released from prison tend to live. So here we see that yoga, despite being for some incarcerated people a significant and potentially healthy practice, can be put out of reach in the community for geographic, cultural, and economic reasons, all of which create barriers to continuing their participation in this potentially healthy activity after they're released. Lastly, I want to think about some alternative ways about thinking about or imagining prison physical activity. And I hope that this section will conclude by offering some potential ways forward in terms of thinking about how sport and physical activity might be healthy for prisoners. One area I've become particularly interested in recently emerges out of carceral geography, a branch of human geography or a subfield that looks at carceral spaces, whether prisons or otherwise. And some carceral geographers have begun considering if or how prisoners might be spaces that enable health enabling spaces. Alternatively, how they might be therapeutic landscapes. And they suggest that incorporating contact with nature into prison design could facilitate such health enabling outcomes. And this includes green spaces, even blue spaces, that is water spaces with therapeutic potential, and interaction with non-human animals. And leaving aside for a moment debates about prison abolition, which is an important debate, but one we don't have time to get into, if incarceration is going to be deemed a societal necessity to greater or lesser degrees, if some people are going to be incarcerated, then I think it's important that we consider how incarceration might actually help facilitate some positive health outcomes despite the negative impacts of being confined. And to consider what role sport and physical activity might play in such a process, and whether sport and physical activity might be incorporated into such health enabling spaces. And I return here to the idea of alternative prison physical activities I brought up earlier. And I largely developed my idea around these in contrast to the typical structure and lived experiences of the dominant forms of physical activity in sport my participants talked about, namely kind of competitive sports or kind of aggressive bodybuilding or fitness kind of subcultures. And these activities, in contrast, are intentionally and sensitively designed. For example, a trauma-informed approach, recognizing the trauma that prisoners have experienced, de-emphasize the competitive and aggressive aspects of sport, and rather than focusing on particular outcomes, such as making sure a prisoner becomes pro-social or completes a rehabilitation plan, rather these empower participants to draw diverse meanings from their participation. For example, some prisoners take yoga classes because they want to get more flexible or to ease muscle pain. Whereas for others, it's a much more transformative process through which they grapple with the trauma of the past and improve their mental health. And this is not to say that competitive sport or even aggressive sports like boxing or martial arts can't be designed in such a way to achieve health benefits. I'm not trying to argue that. And there are examples of such activities both inside and outside of prisons. But through my research, I found that these alternative activities are more likely to have these elements that might contribute to prisoner health. And I realize I'm nearing the end, but I do just want to briefly end this section by talking about my research on yoga in prisons, which is a growing global practice in many prisons. And yoga, of course, combines physical movement through asana or yoga poses with mindfulness. And indeed, much prison yoga is actually taught by two instructors, one who does the physical movement and one who does the mindfulness exercises. And yoga, from my research, often has a trauma-informed approach undergirding it, recognizing that many prisoners have been victimized in their lives and attempting to use yoga as a chance to reflect on that and try to, in some way, to the degree that the prisoner is comfortable, work through that trauma. And yoga has been shown to provide prisoners with a variety of health benefits, including physical health benefits. One that comes up a lot is reduced pain and improved sleep. A mental escape from the realities of incarceration, a chance to kind of focus their mind elsewhere, and learning to manage emotions. And I want to quote at length from Harry, one of my participants, because he gives insight into yoga as a meaningful and potentially health-promoting activity in prison spaces characterized by stress and violence and restricted mobility. And Harry stated, because we were locked down a lot, it was something you could do in your cell. There's such a tremendous amount of stress in prison that it helps. Like if somebody got killed in the institution and you're locked down for a month or whatever, so now you're in your cell. So what do? How do you learn to relax? And the more you get into it, you get into the breathing exercises, you get into meditation and trying to empty out the bad thoughts, just flushing your mind out. And that's what a lot of those exercises are. You're concentrating on the one exercise that you're doing so that you're not thinking about anything else. When something violent would happen, the whole institution would Everybody's on edge. So you could be in your cell and just do some yoga and just relax and chill out. And you could do it in a small space. I ended up getting rid of my bed and just had my mattress so I could roll up so I could do my yoga in my cell. And that way, if you're locked down for 2 or 3 weeks, you could still exercise and still do your relaxation stuff. In the interest of time, I'm just going to very briefly mention the importance of programs that may provide health benefits being set up in such a way that prisoners can continue to access these upon release, and even in such a way that it might facilitate social or even employment networks upon release. And there's evidence, mostly from the UK, that sport programs can indeed be structured in such a way so that prisoners have social and employment opportunities when they're released. And this is extremely important for improving overall health and well-being in the community. And I do also want to mention a couple notes of caution around these alternative or potentially health-promoting activities. Regardless of how well-intentioned they are, how well-structured, physical activity is not a panacea for prisoner health or for easing the pains of imprisonment. And prisons remain spaces of social control, and many of these activities, for example, yoga classes, can be actually used as rewards for desirable behavior rather than offered widely to anyone who might need them. And lastly, there can often be public pushback and negative reaction to the provision of certain activities to prisoners. In the 1990s, there was a moral panic around quote unquote Club Fed, a play on Club Med, prisons, which offered prisoners, all kinds of, opportunities in green space and things like that, as though that was a negative. And indeed, that sort of discourse comes up again, such as in the newspaper article I've clicked on the right. And indeed, even the most well-designed, sensitive, and intentional programs cannot eliminate pains of imprisonment. I'll just briefly mention a famous prison in Norway that's located on an island in a very idyllic setting. Prisoners can move around and walk in the green space unaccompanied. They can bike or even ski. It might appear to be the ultimate example of how physical activity might contribute to a healthy or health-enabling experience of incarceration, but research shows that even in this context, prisoners experience pains, in this case called pains of freedom, arising from the confusion and uncertainty and frustrations where they're sort of free, but still incarcerated and confined against their will. So ultimately, no matter how healthy or free, quote unquote, prisoners are involuntarily confined and will experience pains as a result. And physical activity alone will not resolve this tension. So I conclude with just a couple thoughts. This is my last slide. To kind of sum up, prisons are unhealthy environments, and they can cause significant detriment to those who are incarcerated. Physical activity can contribute and provide health benefits to some prisoners, but this is certainly not true in all cases, nor is it inevitable, and there needs to be intentionality and thought behind how physical activity programs are organized and structured in order to potentially achieve health outcomes for a large number of people. And this will require sensitivity to prisoner needs, intentionality, and creativity if physical activity is to contribute to health enabling spaces within prisons. And ultimately, the problem of prisons being unhealthy is far larger than physical activity can hope to solve on its own, and structural changes are needed if prisons are to be made more healthy. So physical activity may play a role in mitigating the unhealthy aspects of incarceration and the pains of imprisonment, but alone it will not overcome it. Those are the references I quoted, as well as some further reading, some of the sources that draw upon themes I've talked about. And on that note, I want to say thank you very much and apologies for running a little bit over my time. Thank you very much.
Thanks very much, Mark, for your insightful and very interesting talk. For questions, you can place your questions in the chat or raise your hand so we can call on you. No questions? Yeah, Michelle?
Well, thank you very much, Mark. That was really, really interesting. You mentioned in the introduction of your talk that there was a major issue in prisons now, which is, I mean, now it's it has been there for forever, of mental health being an issue, and I suspect there is part of it is mental health deteriorates because you're in jail, and part of it is also that some people are incarcerated precisely because they have mental health issues, and instead of being hospitalized, we use the prison system almost as a substitute for hospitalization. And I was curious to know whether you found that there was a difference, let's say, whether mental health makes a difference in how physical activity and sport can be used and can be also affect the let's say the well-being of inmates. Is there do you find that what you said about physical activity being ambivalent, and does it intersect somehow with the mental health status of inmates?
Sorry, Michelle, just to clarify, do you mean in terms of are people more or less likely to participate based on their mental health, or whether it can contribute to improving mental health?
I would say both. Yeah.
I don't know on the latter point. I don't know that there's a lot of research around sort of the motivations for participating, or the experience of people who want to but don't. Beyond the little bit I've sort of found through participants of people who were kind of excluded from participating for different reasons. I certainly think it can, in a limited fashion, and I don't want to overstate the potential, it can contribute, I think, to improving mental health. I think yoga being the big one, some programs are intentionally designed to try to achieve particular kind of mental health outcomes, for example, like reducing addiction, dependence, or substance dependence. But I think that it certainly seems from my research that the mental health pains that come from being incarcerated, from living in, an unpleasant environment, an environment with a lot of risk, a really stressful environment, it can be a release from that. So I think to some degree it can ease some of the stresses and tensions that characterize daily life. But those stresses and tensions are creating worse mental health problems. So it's really kind of it's using a water gun to put out a house fire, So I think like the mental health of prisoners is such a bigger issue. And it's, as you point out, kind of both an issue in terms of who is being incarcerated and then what they're experiencing while they're there. But I think physical activity could play a role in trying to create better conditions of confinement that would reduce the kind of mental health strain of incarceration. And I obviously suggested a few ways that potentially might happen. So that I don't know if, sorry, I'm kind of speaking pretty broadly, but I don't know if that helps answer your question.
No, I appreciate that. Was a very broad question. I was just curious. Thank you very much.
You're welcome.
Michelle has a question. The question is, will you speak a little about if there are gender differences in the ways that prisoners experience alternative types of physical activity in prison and when they leave prison? I am thinking specifically about yoga.
Yeah, there absolutely are, and I would have liked to talk more about gender, but was limited in time. And I will note that the vast majority of research, I think on prisons generally, but specifically around sport and physical activity, is focused on men's adult prisons. And that's important to note. There is some literature for sure on women's experiences, but it's there isn't as much. When it comes to sort of alternative activities, I can speak to yoga a little bit. I think from my research, for men or boys who are participating, there's a certain amount of stigma around it, just due to the way yoga is kind of popularly constructed as a feminine activity, because of the ideals of masculinity in a prison environment, which often revolve around kind of toughness and aggression, and at least the threat of violence, if not the realization of that, and body types that align with that, and the muscular physiques. There can be some kind of hesitancy amongst male prisoners to participate. But the few prisoners who mentioned doing yoga, and the instructors I've talked with, do say that that's quite quickly overcome. And indeed, particularly in youth prisons, yoga can actually be a really desirable activity for boys to participate in. I think there could be various reasons for that, but I think there's a little bit of a humbling experience when they start and realize that it's actually really physically demanding activity and challenging. And I think also the fact that it's a program run by volunteers who care and who are engaged with their students, and try to make them feel valued, and that's a really important part of the activity. In women's prisons, I think there's less of that stigma, but I think generally speaking, there's also women prisoners are constructed in gendered ways. The risks associated with female prisoners are understood differently by correctional authorities than they are for men. And I think that can lead to different, and in some cases less, programming, because there seem to be less kind of security threats. So where yoga is seen by sort of as a tool to help kind of control the prison population or pacify it, it might actually be less commonly offered. But I know that there are lots of yoga programs for women, and that they are valued by participants. I think everyone I spoke with, though, had taught in either male youth or men's prisons, not women's prisons. I might be wrong on that, so I can't speak directly from my own data, but those are sort of my understandings from the literature around yoga and women's prisons.
Thank you, Emily, for your email and continuing the discussion too. Nicholas has a question. The question is, I was wondering if you have shared any of your findings with decision makers involved within prisons within Canada. If so, how did they respond to some of your findings and some of your alternative sport and physical activity suggestions? If not, do you hope to share your findings and suggestions at some point?
That's a great question. So far, no, but I do intend to. And particularly the current project I'm doing on is physical recreation in youth custody and youth justice settings in Ontario. I've been working closely with some of the organizations that operate youth custody facilities in the province, and hopefully we'll be also speaking with staff at the provincially run facilities. And part of the research will be producing kind of a summary of findings and recommendations. So it's something that's on my radar, but I haven't done yet. But it's definitely something I intend to do, and hopefully it's research that will be of interest and value.
Any more questions?
I think there's time for one more, potentially, if Mark has time. Otherwise, we can wrap up. We'll wait a minute or so.
I have time, so.
Gavin?
Yeah, thanks, Mark. Just an observation, and nothing on, not an observation on your research, but these kinds of fields that are growing, like carceral geographies and carceral sociologies. You know, you've situated your research with respect to them. You almost have to do these days. But I do worry sometimes in terms of these bodies of literature, if they're more careerist than useful. You know, and what I mean is, like, there's certain individuals that have really promoted these fields, and, you know, through things like conference sessions, journal special issues, and things like that. And while they're good for gathering, you know, common research together and applying common concepts, so carceral geography would be urbanicity, rurality, space and place, and things like that. I do wonder if, what I mean by careerist is that, you know, it's just sort of aiding people's research careers, but is it saying anything new? You know, in creating a subdiscipline like carceral geographies, you know, what's new about it, right? I can see what's new about, say, new mobilities or whatever, but not, you know, I'm not so sure. Or maybe it's just because they're, you know, if in gathering things together, people come up with new ideas. But that's just an observation. It seems to be really in vogue at the moment, isn't it, to talk about the carceral elements of your subdiscipline, if you like.
Yeah, I mean, that's a really great point, broadly speaking. And there's always sort of politics around within disciplines around sort of, you know, new frontiers, or whether, or maybe they're not new. I mean, I think I can kind of, speaking to carceral geography, I'm not trying to defend it in any sense. I mean, it's an area that I've found really interesting and resonant with my kind of theoretical interests. So it's not, but I don't have a sense of its kind of broader place within geography. And I'm sure much of what it does theoretically might be drawing from broader traditions. But I do think it's been really helpful for basically spatializing incarceration, for recognizing, and that field has been one of its kind of major focus is the fact that the spatial aspects of carcerality are not at all limited to the prison, that we see them in other ways, in the ways in which, you know, surveillance technologies, you know, are used, or the way in which low-income neighborhoods are policed, you know, other sites like refugee camps or migrant detention centers where people are involuntarily held, and that there's a, you know, or like I kind of talked about, the sort of the fact that aspects of incarceration continue in different spaces when people leave. It's not like you leave prison and you leave that behind. You still carry with you these sort of aspects. So for me, it was really helpful in thinking just beyond the prison about my research, what its implications were, and thinking more deeply about spaces within prisons. But I can't, I mean, you'd be a better place than me to speak to whether that's really unique or novel when it comes to thinking about space in general. But I have found it does draw from sociology and criminology too, quite heavily. So it is, you know, somewhat interdisciplinary or multidisciplinary in its approach. But yeah, I think it's a good point, and I think that, you know, there can be these kind of fads with new subfields, and I'm sure people are, like you say, making careers, you know, and, you know, starting journals, and, you know, being kind of writing the book that everyone cites in the area, etc. So I can't speak to it too much further than that, but I think it is a great point to keep in mind.
Thank you so much, Mark. I just want to thank all of our speakers and attendees from today, but also from the year. We had an incredible group of people join us. So we have much gratitude to the Department of Health, Aging and Society for their support, as well as all the behind the scenes people who make this happen, all the graduate students who pitch in and help out. We're working on getting our YouTube channel up and running, so you can enjoy replays of our talks this year. So keep an eye out on our website and Twitter as we're already planning our 2021-2022 series. So thank you. And thank you again, Mark. Very interesting topic. I'm sure you and I will have some conversations moving forward.
Thanks, everyone. I really appreciate you being here and the thoughtful questions.